two challenges that were presented immediately to us was the need for remote working and the need for delivering telehealth services.
The government called lockdown and called it fairly quickly. So we didn't have that luxury of sitting down thinking, what should we do? We went from 0 to 3 weeks into production with actual users on the system. Now, the hospital itself didn't have the infrastructure to support that huge uplift in remote working. And that's really why the Citrix Cloud solution was such a perfect fit. We were able to really size the solution perfectly for the number of users that Warren and the hospital had on day one, and then expand that out fairly rapidly over time.
Any application that a clinician or a staff member requires to do their role is delivered through the Citrix platform.
The second part of the solution was start to really fine-tune it for telehealth.
It became a very immediate question of we need technology that will allow us to safely and securely interact with patients in what is a fairly sensitive way, in the sense that we're dealing with private and confidential information. We went from 100% face-to-face care to deferring a few people until we could sort things out, and then I think we had our first telehealth consultation within about 2 weeks. I think what we've learned from this and the feedback from our clinical staff has been telehealth or virtual solutions can deliver as good, and in some cases better, service for patients than a face-to-face consultation.
The solution itself has fundamentally changed people's thinking about how hospitals can function. It's one of the highlights of my career being part of this project, because I think it can have a really significant impact on the way health services are delivered, not only in Victoria, but I also think around Australia.